So imagine sitting down to like a perfectly healthy meal. You've got your balanced macros, your fresh ingredients, just a really beautiful plate of food, right?
Right, the kind of meal you feel good about eating.
Exactly. So you eat it, and you're expecting your body to do what it has basically evolved to do over millions of years, which is, extract the nutrients, fuel your cells, keep you moving.
Right, the basic biological deal we make with our food.
Yeah, but what if instead of doing that, your body just practically ignores those nutrients? Or actually, worse than that, what if it treats them like an invading army and launches a full-scale biological war in your gut?
It's a terrifying paradox because you are actively eating, right? But on a cellular level, your body is, well, it's slowly starving to death.
It really is. And that's what we're getting into today. We are taking a deep dive into this massive stack of recent gastroenterology reports, clinical data, and medical guidelines to uncover why this actually happens.
That's a really complex topic, yeah.
It is. Our focus today is on severe gastrointestinal malabsorption disorders, and we're going to use unmanaged celiac disease as our ultimate case study to figure out how this biological war even starts.
Which is perfect because celiac it's kind of the ideal model for this. It just beautifully and tragically really illustrates how interconnected our bodily systems are. When you look at the clinical data, you realize that the gut isn't just, a digestive tube. It's actually the control center for your entire immune and endocrine system.
Right, which means that even if listening right now, even if you don't have severe GI issues, you should really care about this.
Absolutely.
Because understanding how our bodies assimilate or violently reject nutrients, it reveals the incredibly delicate microscopic machinery that is keeping us alive every single second.
Right, and it shows how easily one single everyday protein can just throw that entire system into absolute chaos.
Right. But before we get into the really bizarre and surprising systemic symptoms of all this, because there are some wild ones, we need to establish what malabsorption actually is, just mechanically speaking.
That's a good place to start, because it often gets confused with maldigestion.
Yeah, I've definitely used those words interchangeably before.
Most people do, but the European consensus guidelines on malabsorption make a very, very clear clinical distinction between the two.
Okay, let's unpack that. What is the actual clinical difference?
So maldigestion is a failure to break food down. Think of it like a processing error in a manufacturing plant.
Okay, processing error.
Right. So, for example, if a patient has exocrine pancreatic insufficiency, their pancreas just isn't producing the digestive enzymes like lipases and proteases that are needed to chemically chop the food into tiny absorbable pieces.
Right, so the food is physically there in the intestine, but the molecules are just too large to cross the cellular barrier into the body.
Exactly. The machinery broke down.
Okay, so maldigestion is the factory machinery breaking down. The raw materials never become the final product.
Right.
But malabsorption, that means the factory worked perfectly, the boxes are packed, they're ready to go, but the loading dock is completely boarded up and the delivery trucks are broken, so the cargo just sits there until it gets thrown out.
Honestly, that captures the mechanics perfectly. In malabsorption, the failure is in the intestinal mucosa, the inner lining of your gut. It loses the physical ability to uptake those perfectly broken down nutrients and transport them into your bloodstream or lymphatic system.
Which brings us to celiac disease, which, according to the UK data in our sources, affects about 1 in 100 people.
Yeah, it's remarkably common.
And the sources paint this really vivid picture of what a damaged loading dock actually looks like. I want to give you, the listener, a visual analogy here.
Oh, go for it.
Think of the lining of your small intestine like a plush 1970s shag carpet, right? Those millions of tiny finger-like fibers sticking up, those are called villi. And their entire job is to create a massive surface area to catch and absorb nutrients as they float by.
Right.
But in celiac disease, the immune system basically drops bombs on that carpet until it is completely flattened out.
Yeah.
The medical term is villus atrophy. So it goes from a thick shag carpet to flat linoleum.
It's a great analogy because when you look at a healthy intestine under a microscope, the total surface area created by those vast numbers of villi is roughly the size of a tennis court.
A whole tennis court inside you.
Yeah, inside your gut.
Right.
But in severe celiac, that surface area is just obliterated. So on flat linoleum, like you said, the nutrients just wash right past, completely unabsorbed.
Okay, wait. I want to challenge the logic of this mechanism for a second. Yeah. Because human beings have been cultivating and eating wheat for, what, roughly 10,000 years?
Something like that, yeah.
So why would the human immune system suddenly start treating a basic foundational grain like it's the bubonic plague? I
Mm.
mean, that just doesn't make evolutionary sense.
It's a really fascinating evolutionary question. But the thing is, the immune system isn't reacting to the whole grain. It's flagging a very specific, difficult to digest peptide sequence within gluten, which is called gliadin.
Okay, gliadin.
Right. And in most people, gliadin just passes through safely. But in people with a specific genetic predisposition, specifically variations in the HLA genes, which regulate the immune system, the body misidentifies gliadin as a dangerous pathogen.
So it's an identification error.
Exactly.
But is the gluten acting like a poison that burns the villi, or is our own body doing the damage?
It is entirely our own body. It's the ultimate friendly fire scenario.
Wow.
Yeah. Once the immune system flags gliadin as a threat, it produces highly specific weapons to fight it. Notably, these anti-transglutaminase, or TTG, antibodies.
Okay, the TTG antibodies, we see those mentioned constantly in the diagnostic guidelines.
Yes, and here's where the friendly fire actually happens. These antibodies don't just attack the gluten, they mistakenly target the body's own essential enzyme tissue transglutaminase.
Wait, so the body's enzyme, what does it do?
It naturally lives in the gut lining, and it helps repair tissue.
Oh, man.
Right. So the immune system binds to this repair enzyme, essentially declaring war on the very structure of the intestine itself. The tissue isn't destroyed by the gluten directly. It's destroyed by the crossfire of the body's own immune response.
That is wild.
Mm.
So if the gut's shag carpet is flattened into linoleum by this crossfire and nutrients aren't being absorbed into the blood, what happens to the rest of the body?
Well,
Because if you're listening to this and thinking, I'm tired a lot, my stomach hurts sometimes, is my gut carpet flattened? Like, how do we differentiate this from everyday fatigue?
that's the million-dollar question.
Because a huge false assumption I saw in these clinical sources is that people think a GI disorder just means stomach pain, bloating, or diarrhea.
And that assumption, unfortunately, delays clinical diagnosis for years, sometimes decades, honestly.
Decades. Just thinking it's a bad stomach.
Yeah. While gastrointestinal symptoms are common, like steatorrhea, which is chronic diarrhea containing high amounts of unabsorbed fat because, like your analogy, the delivery trucks are broken and the fat just slides straight to the exit.
Right.
The non-gastrointestinal symptoms are often the real screaming red flags.
Okay, let's walk through the biological journey of those symptoms. Because from the reading, it looks like a systemic domino effect.
It really is. Let's start with bone health. Your body requires a constant supply of calcium and vitamin D to maintain your skeleton.
Okay, sure.
If your flattened villi can't absorb those from your food, your blood calcium levels drop. But your heart and your nerves need calcium to fire properly. So your body prioritizes the heart over the skeleton, and it literally starts mining calcium directly from your bones.
Oh my God.
Yeah, this leads to osteomalacia, which is the softening of bones, and early onset osteoporosis.
So the body is literally cannibalizing its own skeleton just to keep the heart beating.
Correct. It's survival mode. Now look at the blood. To manufacture healthy red blood cells, your bone marrow desperately needs iron, folate, and vitamin B12.
Right.
B12 is crucial for DNA synthesis. When your gut can't absorb B12, your red blood cells can't divide properly. They become abnormally large, scarce, and just incredibly inefficient at carrying oxygen.
Which manifests as anemia, right?
Severe anemia. Patients experience profound, crushing fatigue and shortness of breath simply because their tissues are practically suffocating.
That's horrifying. And the pediatric guidelines outline how this systemic energy crisis impacts children. And it's just heartbreaking.
It really is hard to read.
Like you might see a toddler with faltering growth and severe muscle wasting, literally thin arms and legs,
Right.
but a completely distended, bloated tummy.
Yes.
And that bloating is from all the unabsorbed food fermenting in the large intestine, right?
All right.
And if it goes unmanaged, the body actually halts puberty because it simply doesn't have the biological fuel to mature.
It forces the body into a state of deep conservation. Everything non-essential is just shut down.
And then there was the symptoms that seem utterly bizarre, totally disconnected from the stomach, like dermatitis herpetiformis.
Oh, yes. The skin rash.
Yeah. The sources describe this as an intensely itchy, blistering skin rash that usually pops up on the elbows, knees, and buttocks. How does a gut disorder cause blisters on your elbows? That makes no sense.
It seems random, but it comes back to those TTG antibodies we discussed earlier.
The friendly fire ones?
Exactly. The immune system is producing these antibodies in the gut, But they don't just stay there. They enter the bloodstream and circulate throughout the entire body. Eventually, they deposit themselves under the top layer of the skin.
Okay.
And once they're there, they attract white blood cells called neutrophils, which release inflammatory chemicals that cause the skin to literally separate and form those intensely itchy blisters.
Wow. So the war in the gut spills over into the bloodstream and basically erupts on the skin. Which makes me ask, how is all of this destructive chaos different from someone who just feels like a bit bloated and tired after eating a few slices of sourdough bread?
That is a very crucial distinction to make. Non-celiac gluten sensitivity is a very real, recognized condition. It involves a broader immune response that can cause low-grade inflammation, bloating, and fatigue.
Right.
But, and this is the definitive biological difference, it lacks those specific autoimmune TTG markers, and it does not cause villus atrophy. The shag carpet remains intact.
Okay, so celiac is a destructive autoimmune disease, whereas sensitivity is more of a localized intolerance.
Precisely.
Got it. Now, while reading through the systemic impacts of that destruction, there was one area that genuinely stopped me in my tracks.
The obstetric data.
Yes. It doesn't just impact a patient's bones or skin. It can profoundly disrupt the creation of new life altogether.
The link between unmanaged malabsorption and women's reproductive health is one of the most severe yet under-discussed complications in gastroenterology, I think.
It's shocking.
Women with undiagnosed celiac disease face significantly higher risks of unexplained subfertility, recurrent miscarriages, intrauterine growth restriction, and preterm labor.
But is this purely a matter of malnutrition? Like the mother's body recognizes it's starving and essentially pulls the plug on the pregnancy because it can't sustain it.
Severe nutrient deficiencies definitely play a massive role. I mean, a developing fetus requires massive amounts of folic acid to form a neural tube and calcium to build a skeleton.
Let's get the building blocks.
Right. If the mother can't absorb them, the pregnancy lacks those fundamental blocks. But there is a much more active, aggressive mechanism at play here, too. It goes back to those antibodies.
The TTG antibodies circulating in the blood.
Yes. Tissue transglutaminase, the enzyme those antibodies mistakenly attack, isn't just found in the gut.
Oh, no.
Yeah, it is also heavily present in placental tissue and the uterine lining.
You're kidding.
I wish I was. Research strongly suggests that the mother's immune system, triggered by gluten, sends these antibodies to the placenta, where they bind to the tissue and trigger inflammation. They actively damage the placenta, creating an inhospitable environment for an embryo to implant and grow.
So the mother's own immune system, confused by a dietary protein, is actively attacking the baby's life support system.
Sadly, yes. Furthermore, the overall fertility window for these women actually physically shrinks. We mentioned delayed puberty earlier, but untreated celiac is also linked to early onset menopause.
So the reproductive years are compressed on both ends.
Exactly.
Man, given those massive stakes, catching the disorder early is absolutely critical. So let's talk about the diagnostic detective work. How do doctors actually prove the villi are flattened?
Well, the journey to diagnosis is notoriously frustrating. Yeah, routine screening for celiac isn't recommended for the general population. Doctors usually only initiate testing if there are persistent symptoms, like that unexplained anemia or the blistering skin rash, or if the patient has a family history or another autoimmune condition like type 1 diabetes.
But the testing itself has a built-in catch-22. I started calling it the gluten trap when I was reading the sources.
The gluten trap. It's an incredibly difficult hurdle for patients.
Right, because the first diagnostic step is a blood test to look for those circulating TTG antibodies.
Correct. But the immune system is highly efficient. It doesn't keep producing weapons if the enemy isn't present.
Right. So if a patient feels terrible, figures out on their own that bread makes them sick, and stops eating gluten for 3 months before finally seeing a gastroenterologist, their blood test will come back completely normal.
Precisely. Because the gluten is gone, the antibody production has stopped, even if the gut is still heavily damaged. To get an accurate blood test, doctors often have to instruct patients to undergo a gluten challenge.
Which means actively eating the very thing that makes them violently ill.
Yes, for several weeks, just to trigger the immune response so it can be measured.
Which sounds like absolute misery. But, okay, if the patient endures that and the blood tests come back showing high antibodies, what happens next?
The gold standard for definitive diagnosis is an endoscopy with a biopsy.
Okay.
So a gastroenterologist passes a flexible tube down the throat, past the stomach, and into the duodenum, which is the very first segment of the small intestine. They take several tiny tissue samples, about 2 to 3 millimeters each.
And then they look at it under a microscope.
Exactly. A pathologist examines that tissue to visually confirm the battlefield.
And they grade the destruction using something called the Marsh-Oberhuber classification system.
Yes, it's essentially a scale of devastation. It ranges from Marsh 0, which is a perfectly healthy shag carpet, up to Marsh 3, which is categorized into A, B, and C.
And Marsh 3C represents total villous atrophy.
Right. The carpet is completely gone. It is entirely flat linoleum, severely inflamed and flooded with white blood cells.
Okay, so if the biopsy shows us the physical damage the immune system is causing, the next logical question is, why does one person's immune system pull this trigger while someone with the exact same genetic risk doesn't?
It's the biggest question in the field right now.
And that brings us to the gut environment itself. In a fascinating study that recently came out in Nature Genetics called the Hunt-GWAS study, they looked at a specific gut microbe called Agathobacter.
This represents the absolute cutting edge of gastroenterology.
Okay, tell me more.
They examined a specific neighborhood in our DNA known as the HLA-DQB1 locus, which is the area strongly associated with celiac risk.
Right.
And they found that a specific genetic variant in that neighborhood correlates with an increased abundance of the Agathobacter microbe in the gut, and simultaneously a reduced risk for celiac disease.
Okay, I have to push back here.
Go ahead.
Because in almost every deep dive we do on health, we end up blaming the microbiome. It feels like a convenient scapegoat sometimes. Correlation isn't causation,
Right.
Does a lack of this Agathobacter bacteria cause celiac disease? Or does the violent immune response of celiac disease simply wipe out the Agathobacter?
That is exactly the right question to ask, and it's the core problem with most microbiome research. But to solve that, the researchers didn't just look at observational data. They used a highly sophisticated analytical method called Mendelian randomization.
Mendelian randomization, how does that actually prove causation?
Think of it like nature's randomized clinical trial. We know that genetic variants are randomly assigned at birth, like a coin flip.
Right.
Mendelian randomization tracks those coin flips. If people who inherited the genetic variant for higher Agathobacter consistently show lower rates of celiac disease over their lifespan, researchers can trace the arrow of causality, because we know the disease didn't cause their genetics.
Ah, okay. The genes came first.
Yes. And what they found was that having celiac disease causally reduces the levels of Agathobacter.
Oh, wow.
Yeah, the active autoimmune disease changes the landscape of the gut, making it hostile to this specific, potentially protective bacteria.
So it's a massive biological feedback loop. Our human genetics dictate the environment, which dictates the microbial population, which in turn might influence how severe the disease becomes.
Exactly. It provides the first concrete genetic evidence of how our human DNA shapes the microbial ecosystem in our gut. It's completely altering how we view the pathogenesis, the origin and development of these autoimmune disorders.
So let's say the detective work is fully done. The biopsy shows a Marsh 3 score, the villi are completely flat, the microbiome is devastated. How do we fix it? What is the medical intervention?
The treatment is conceptually elegant, but practically exhausting. It is a strict, lifelong, 100% gluten-free diet.
That's it?
That's it. There are no pills, no surgeries, just complete dietary avoidance, no exceptions, and absolutely no cheat days.
And I really want to emphasize what the medical guidelines mean by strict, because a lot of people might think, well, a little crumb on a cutting board won't hurt, right? But the sources are adamant that even microscopic cross-contamination is disastrous.
People naturally assume the biological reaction is volume dependent. They think, if I eat a whole bowl of pasta, I'll get severely ill, but if I eat a crouton, I'll only get a little bit inflamed.
But the mechanism we discussed earlier proves it's not a volume issue. It's a tripwire.
Yes.
It doesn't matter if you barely brush your toe against the tripwire or if you stomp on it with both feet. The alarm still goes off, and the immune system drops the same payload of bombs.
That is the perfect way to understand it. It is the scale of the immune alarm, not the physical volume of the gluten, that dictates the damage. That one microscopic crumb triggers the entire systemic cascade, bringing the TTG antibodies right back to the gut lining to destroy whatever villi have managed to regrow.
And the clinical data highlights some incredibly dark complications for patients who remain undiagnosed or who repeatedly cheat on the diet and trip that wire. We already talked about osteoporosis and reproductive failure, but chronic inflammation takes a heavier toll, right?
It does. Untreated celiac disease keeps the immune system in a perpetual state of hyperarousal, which eventually compromises its ability to fight actual threats.
Right. The immune system is exhausted.
Exactly. Patients become highly susceptible to severe bacterial infections, like pneumococcal pneumonia. But the most severe complication is a rare form of cancer called enteropathy-associated T-cell lymphoma.
Wow. So the constant destruction and rebuilding of the cells eventually leads to a genetic mutation?
Yes, decades of chronic violent inflammation in the intestine dramatically increase the risk of those immune T cells actually turning malignant.
Wow. Okay, on a slightly less terrifying but highly annoying note, the sources point out that untreated celiac often triggers secondary lactose intolerance.
Oh, yes. This is very common.
And the mechanism here is just fascinating. The enzyme required to break down dairy sugar lactase is produced at the very tips of the villi, like the highest point of the shag carpet.
So when the carpet is burned down to flat linoleum, the factory producing the lactase is destroyed right along with it. The body completely loses the ability to process dairy.
That is so unfair.
It is, but fortunately, if a patient adheres strictly to the gluten-free diet, that lactase production almost always returns as the gut heals and the villi grow back.
Which brings us to the timeline. How long does it actually take for the body to regrow millions of microscopic villi once the tripwire is finally deactivated?
It requires immense patience. There's a 10-year pediatric study published in the Archives of Medical Science that tracked children diagnosed with severe Marsh type 3 lesions.
Okay, the flat linoleum.
Right. They found that about 81% saw histologic remission, meaning the pathologist confirmed the villi had actually grown back within 1 year on the strict diet.
Over 80% in a year. That's incredibly fast cellular turnover for kids.
Well, the pediatric metabolism is remarkably resilient. Over a 3-year period, 97.6% of those children achieved full mucosal recovery.
That's amazing.
It is. However, the data clearly shows that adults heal much, much slower. For an adult with decades of damage, full mucosal healing can take up to 5 years. And in a small percentage of patients, the villi never fully recover their original height, even with perfect dietary adherence.
So what does this all mean? Let's bring this vast amount of medical data together for you listening. Malabsorption, particularly through the lens of unmanaged celiac disease, is far more than an upset stomach.
Far more.
It is a profound systemic failure where the body's own defense network goes to war with itself over a simple dietary protein. It's a microscopic friendly fire that flattens the gut lining, forces the body to mine its own skeleton for calcium, crashes your blood oxygen by halting cell division, and actively threatens human reproduction by attacking the placenta.
It's devastating. But the profound takeaway from all these clinical guidelines is the astonishing resilience of the human body.
Yeah.
By simply removing a single protein sequence from the environment, that devastated biological landscape can miraculously rebuild itself from flat linoleum back to a thriving, absorptive ecosystem.
It's an incredible testament to human biology.
It truly is. And I want to leave you with a final thought to mull over, building on that Nature Genetics microbiome study we discussed earlier.
Oh, yeah.
We've just seen how deeply intertwined our human genetics, our immune responses, and our microbial populations actually are.
Right, our genetics setting the stage for both the bacteria and the disease.
Exactly. So if consuming a single, highly cultivated plant protein can so fundamentally reshape our gut architecture and trigger such violent systemic immune responses based on a genetic predisposition,
Yeah.
what other modern dietary habits or highly processed novel ingredients might be quietly flipping genetic tripwires in our bodies right now? Tripwires that medical science simply hasn't discovered yet.
Oh, wow. That is a fascinating and slightly terrifying question to end on. Thank you for joining us on this deep dive. Remember, pay attention to the signals your body is sending you, listen to your gut literally, and keep learning.